Imagine you're a doctor or even a patient, and you're staring at a medical mystery. You've got two key pieces of evidence right in front of you. But here's the thing, they tell completely opposite stories. One report is basically screaming, "Danger!" while the other is whispering that everything's fine. That's the exact puzzle we're going to piece together today.
So what do? It's a tough spot to be in. You have this really frightening lab result, but then you've got this image that looks, well, pretty reassuring. Which one do you trust? The stakes here are about as high as they get.
Professor Laszlo Tabar just nails this paradox. He asks, what's the real value of a scary triple-negative diagnosis when the pictures, the images themselves, are telling us this thing is growing at the speed of a snail? That one question is really the heart of this whole story.
All right, so let's jump right in. Let's meet the patient at the center of this dilemma and see exactly how this whole thing started.
So our story starts with a 50-year-old woman who went in for a totally routine mammogram. And then she gets that call, the one nobody wants to get, the callback. The doctor saw something, an asymmetric density is the technical term, and she needed to come back in for more tests. And right there, that's where the uncertainty begins.
And this is the central conflict, laid out plain and simple. On one side, the lab results come back with a triple-negative diagnosis. And trust me, that's a concerning result. But on the other side, you have the images, looked at over a couple of years, showing that this thing is growing incredibly slowly. It's the lab versus the lens.
So first, let's dig into the evidence that set off all the alarm bells, that frightening diagnosis that came from the lab.
Okay, so what in the world is triple-negative breast cancer? Well, to put it simply, it means the cancer cells are missing the three most common receptors that doctors use as targets for treatment. So without those targets, it can be a more aggressive, more challenging cancer to fight. So you can see why just hearing that label would be pretty scary.
And this wasn't just some abstract idea. It was a concrete lab result. The report from the lab after they looked at the tissue under a microscope confirmed it, a 6 by 6 millimeter grade 2 triple-negative tumor. It was right there, in black and white. The scary part was now a clinical fact.
So that's the story the lab was telling. A pretty scary one, right? But the mammograms? They were telling a completely different story. Let's take a look at the evidence from the images.
Now, this visual story didn't just appear overnight. It was collected over 26 months. We have the first screening and then follow-ups at a few different points, all the way up to a scan taken more than 2 years later. This timeline is absolutely key to understanding what was really going on.
Okay, this is where it gets really fascinating. On the left, you see the initial mammogram. Now look to the right. That's the exact same view, but 26 months later. I mean, look closely. The change is so subtle. Over more than 2 years, it's barely grown at all.
And that wasn't a fluke. Here's a totally different angle that just confirms the story. Again, baseline on the left, 26-month follow-up on the right. The story is the same, just this minimal, almost impossible to see change over a really long time.
And this closer look just drives the point home, bringing us right back to Professor Tabar's incredible analogy. This is, without a doubt, growth at the speed of a snail. The visual evidence is just screaming something that completely contradicts that aggressive triple-negative label.
So you have these two conflicting truths staring you in the face. How on earth did the medical team get to a final verdict? What was the right thing to do for this patient?
Well, they didn't just flip a coin. They followed a very clear, methodical path. It started with all that detailed imaging we just saw. Then they did an ultrasound to get a different kind of look. That led to a crucial biopsy to get a tissue sample, and all of that led to a surgical consultation.
And here you can see that key step in action. An ultrasound-guided biopsy is what lets doctors be incredibly precise, targeting the exact area of concern to get a tissue sample. This is actually how they got the material for that triple-negative diagnosis in the first place.
So ultimately, the decision was made to go in and surgically remove the tumor. This picture shows the specimen after it was removed. And doing this serves two purposes. It treats the cancer, of course, but it also lets the pathologists do a complete, thorough analysis of the entire thing.
So even with that snail-like growth, the expert opinion was decisive. Professor Tabar concluded this was a surgical disease. In his view, the confirmed presence of a triple-negative cancer, no matter how slowly it was behaving, meant it had to come out. Period.
So how did this all come together in the end? You've got these two conflicting truths, but just one patient
whose health and life are on the line.
And here it is, the best possible news. This is the follow-up report. 2 years and 9 months after that diagnosis and surgery, the patient is doing well, no signs of recurrence. It goes to show the right decision was made and it led to a fantastic outcome.
So what's the big takeaway from all this? It's that in this case, the tumor's actual behavior over time, that super slow growth, was a much more reliable clue to its real threat than its scary molecular label was. This time, the snail told a truer story than the scare.
And this really leaves us with a huge question to think about, doesn't it? Does a scary label in medicine or anywhere else in life really ever tell the whole story? This case is a beautiful illustration that sometimes the most important truths aren't in a single data point, but in watching the whole picture over time